Here is a detailed overview of the Cyanide Antidote Kit, covering all the required points comprehensively. Now, Cyanide Antidote Kit, full drug information. 1. Generic name, drug class, drug forms, brand name, generic name, drug class, drug form, brand name. Full drug information. 1. Amyl nitrite. Amyl nitrite, nitrate vasodilator, cyanide antidote, inhalation ampules, crushable pearls, generic only. 2. Sodium nitrite, antidote, vasodilator, IV solution, 300 milligrams, 10 milliliters, methiodote, sometimes. 3. Sodium thiosulfate, sulfur donor, cyanide antidote, IV solution, 12.5 gram, 50 milliliters, thiosol, generic. The Cyanide Antidote Kit contains all three components, often packed together for emergency use. Definition. The Cyanide Antidote Kit is a medical emergency treatment used to counteract the life-threatening effects of cyanide poisoning. Cyanide inhibits the body's ability to use oxygen at the cellular level, leading to rapid tissue hypoxia and death. This kit neutralizes cyanide by converting it into non-toxic compounds or forms that can be safely excreted by the body. Mechanism of action. Each component acts synergistically to neutralize cyanide. Amyl nitrite and sodium nitrite. These oxidize hemoglobin into methemoglobin. Methemoglobin binds cyanide to form cyanomethemoglobin, preventing cyanide from interfering with cytochrome oxidase in mitochondria, which halts cellular respiration. Sodium thiosulfate provides a sulfur donor required by the enzyme rhodinase to convert cyanide into thiocyanate, a non-toxic compound. Thiocyanate is excreted via the kidneys. 4. Uses. Immediate treatment of cyanide poisoning, particularly in industrial exposure, e.g. mining, metal processing, plastic production, laboratory accidents, smoke inhalation from enclosed space fires involving plastic or foam, terrorist attacks using cyanide-based agents, cyanide ingestion or injection. 5. Indication. Confirmed or suspected cyanide toxicity as evidenced by rapid loss of consciousness, seizures, cardiovascular collapse, high lactate 10 millimolar, metabolic acidosis, cherry red skin occasionally. The antidote kit should be used when clinical suspicion of cyanide poisoning is high, even before lab confirmation. 6. Contraindication. Absolute contraindications, known hypersensitivity to any component, relative contraindications, use with caution, severe anemia, G6PD deficiency, risk of hemolysis, hypotension, pre-existing methemoglobinemia. 7 precautions before taking this medicine. Patient-specific cautions. Inform the healthcare provider if the patient has anemia or blood disorders, kidney impairment, cardiovascular disease, respiratory disorders, glucose 6-phosphate dehydrogenase, G6PD deficiency. Monitoring required. Blood pressure, oxygen saturation, ECG monitoring, methemoglobin levels, renal function, serum lactate levels to assess effectiveness. 8. How to use. Administered by trained professionals only in emergency or hospital settings. Step-by-step usage. 1. Amyl nitrite. Crush the ampule. Allow patient to inhale vapors or administer via face mask. Use for 15 to 30 seconds every minute until IV sodium nitrite is ready. 2. Sodium nitrite. Administer IV slowly over 5 to 10 minutes. Creates methemoglobin to bind cyanide. 3. Sodium thiosulfate. Administer EV over 10-20 minutes following sodium nitrite. Converts cyanide to thiocyanate. And I have start 9. Dosing information. Adult dose. Pediatric dosement. Sodium nitrite. Inhalation of 0.3 milliliter vapor every minute. Every minute. Same as adult or based on clinical judgment. Sodium nitrite. 300 milligrams IV over 5 to 10 minutes. 6 milligrams kilogram IV max 300 thiosulfate. 12.5 grams IV over 10 to 20 minutes. 250 milligrams kilogram IV max 12.5 gram. Repeat dosing may be considered if symptoms persist under medical supervision. 10. Missed dose, not applicable, used as a single administration in emergency settings. Overdose, sodium nitrite overdose, profound methemoglobinemia, hypotension, cardiovascular collapse, sodium thiosulfate. Overdose, rare but can cause renal overload, nausea, or fluid electrolyte imbalance. Treatment, supportive care, methylene blue IV for methemoglobinemia, oxygen IV fluids, vasopressors if hypotensive. Monitor renal function and electrolytes. 11. Stop or avoid taking. Avoid repeated use unless directed by a physician. Stop if methemoglobinemia exceeds safe levels, 30 to 40%, severe hypotension develops, no evidence of cyanide toxicity. NASH 12. Side effects in detail. Common side effects: dizziness, headache, flushing, nausea and vomiting, chest tightness due to vasodilation, metallic taste, sodium thiosulfate. Serious side effects: severe hypotension, sodium nitrite, methemoglobinemia, excessive formation causing hypoxia, seizures, anaphylaxis, renal dysfunction, sodium thiosulfate, hemolytic anemia, especially in GIXPD deficient patients. NAH 13. Vital information. Time is critical in cyanide poisoning. Administer without delay if suspected. Use 100% oxygen simultaneously. Hydroxycobalamin, Cyanokit, is now preferred in some guidelines due to fewer side effects. Monitor lactate and arterial blood gases, methemoglobin levels after administration. Ensure renal function is adequate for thiocyanate excretion. 14. Drug interactions. Other drugs will affect. Drug interaction effects after administration. Methylene blue may reverse methemoglobinemia caused by nitrites. Other vasodilators, e.g. nitrates, increased risk of severe hypotension, diuretics, additive effect on renal excretion. Drugs causing methemoglobin, e.g. benzocaine, dapsone, additive effect. Renal impairing agents may delay thiocyanate clearance, toxic accumulation. Hydroxycobalamin may bind to other drugs, alter lab tests. Thank you. Have a nice day.